Well, hello. I'm Trish Banks. I'm at Renew Health and Wellness. I want to welcome you tonight to the webinar on bioidentical hormone replacement therapy. Before I get started, though, I'd really like to know that you guys can see and hear me. Just a technical check. So if you could raise your hand just to let me know. Great. Wonderful. So thank you so much. So I'm assuming then, since we've got some of you that raised your hand, that it's working. So that's awesome. All right. Well, welcome. I'm so glad you're here tonight, and I'm excited to share the information on hormone replacement here at Renew. I just want to start with a little background for those of you that don't know. We have been open here in the West End of Richmond and Glen Allen for the last 10 years. We're actually celebrating our 10th anniversary this month. So we started out with bioidentical hormones 10 years ago, and over the years have added other programs and services as we've grown, and our client base has really grown, and a lot of people were interested in weight loss and aesthetics and things, our current clients. So we are a pretty broad practice now, but I will tell you that still the biggest part of this practice is our hormone replacement, and it's all natural, bioidentical. I personally have worked here for the last over 8 years, and I've been a client for 9. So I started out here, went through menopause and was miserable, and eventually found Renew Health and Wellness and started, and I've never looked back. So didn't work here when I started. I just started the program. I guess I had been a client here for about 1.5 years when I started working here, but it's incredible. So it's life-changing. Certainly quality of life and health greatly improve on the therapy. And I want to share that with you tonight. So I'm going to share my screen with you, and I'm going to go through a PowerPoint. Want to let you know that I will, at the end of this PowerPoint, definitely answer any questions that you have. So if you want, you can use the chat box and ask me questions. I also check the Q&A, whatever's easier for you. But anything that you think of tonight, even during my PowerPoint, you can go ahead and type it in. And once this is finished, I'm going to go back and answer your questions. So welcome once again. And let me share my screen with you so you can find out more. There we go. So bioidentical hormone replacement, we refer to it as BHRT for short, the initials, and it simply means that we are replacing your matching hormones to what you used to make. So that's why we can use the term bioidentical. So there's a lot of different choices with hormone replacement. They're synthetic hormones, and those have been around quite a long time. If your mom was on hormones, she was probably on synthetic hormones. Those are hormones that are equine based, or they come from horses. They do help with some of the symptoms of menopause and andropause, but the issue with that is that there's a link to cancer and some other nasty stuff, blood clots and things like that. So those have actually kind of been certainly reduced. The use of after there was a big study in the 90s that basically showed the link to cancer, and they had to end the study early. So many of the participants were, getting sick. So they ended the study early, and a lot of doctors stopped using synthetics altogether. But then about 25 years ago or so, bioidenticals were being used in little places in this country. It wasn't widespread. But over the last 25 years, it's been spreading. It came from Europe. They were used in Europe since like the 1930s. What's wonderful about them is they come from vegetables, yams, to be exact. And in your body, they actually work the exact same way that your hormones do, go through the same neuropathways and the same pathways in your body. They're wonderful health anti-aging and healthy. So that's the difference between synthetic and the bioidentical. Like I mentioned, they are identical to the hormones your body used to make, or maybe your body is still making them. So a lot of clients that come in here are in perimenopause. So they have some of the symptoms, they might have some hot flashes, or they might be irritable, moody, waking up at night, not feeling like themselves, fatigue, low sex drive. These are all just symptoms of low hormone levels. And men have it too. Men, we call it andropause, but it's similar in that, and they can become very fatigued, lower sex drive. They can have ED and some other issues. So when those things start creeping in, you may or may not have some hormones left. Most women start in perimenopause with some of the symptoms, and then it just progresses. So when peri is a place where you're still making some hormones, but you're not balanced anymore. So it can also cause irregular periods. Even, you can even stop your cycle and then it can start back up in 6 months. For men, it's a gradual lowering. And so they start usually feeling the effects of low hormones in their 50s, some in their 40s, 40s, 50s, and certainly 60s. So getting them replaced is really going to make it basically takes away your symptoms. So they're physiologically replacing what you're missing. They communicate perfectly with receptor cells to perform the tasks that your body needs. And there's a lot of research now. Scientific research continues to accrue in support of BHRT. And like I mentioned, they've been used safely around the world since the 1930s. So there is not a study that links natural BHRT to cancer. So my mom died of cancer, but I've been on them, like I mentioned, 9 years, and I'll be on them till I'm 100, because I can just tell you, not only for myself, but seeing our clients and their health improvements, and certainly how they feel so much better. I just can't imagine being without them, and they can't either. So, all right. So who needs it? Well, anybody who is not balanced. And so that, like I mentioned earlier, you could be making some hormones and missing others, or just not be making the appropriate levels of hormones. So women need 3, postmenopause: estrogen, progesterone, testosterone. Men typically testosterone only. Some men do need a little progesterone based on their labs. But we look at blood, and that's going to tell us what you got and what you don't have. And so why do you need it? Well, you probably wouldn't be on this webinar if you had great levels, right? So you need it because you don't feel great without good levels. I mean, when we're young, we have energy, we have a sex drive, our joints feel good, we stay motivated. And then when our hormones either start dropping or basically disappear, like mine very suddenly just stopped my period, and then I just kind of went right into all the symptoms. So however it happens for you, certainly when it happens, you'll have some of those symptoms. So you need it because when you get your messengers back, all of a sudden the symptoms go away. So your hot flashes and night sweats are going to be gone when your levels are where they need to be. You sleep all night without waking up and having that race, I call it race brain, where you're waking up and laying there going, why am I thinking about this at 3 a.m? Your joints, it's a biggie. A lot of people start getting joint pain and they think, well, it must be because I'm getting older. It's really low hormone levels for most of us. I mean, I have arthritis too, osteoarthritis, but I will tell you, when my levels are good, my joints don't hurt. When my levels drop, my joints do. So it's definitely related. Other health benefits to this are increased bone density for men and women. So osteopenia and osteoporosis is a big risk for postmenopausal women, especially. And one of the biggest reasons for being put into rehab and nursing homes as we age is broken bones. Broken hips is a big cause of it. So when you have strong bones, it's certainly going to help you as you age. Other things, muscle tone for men and women. So weight gain is a big problem for women and men. when their hormone levels drop, because when we don't have good muscle tone, what replaces the muscle is body fat. So we start accumulating more visceral fat and more body fat. So getting your muscle, your ability to build muscle back with the hormones definitely helps with body composition. Your brain, that's a biggie. So there's a new study out. Well, it's not that new, 2018, I think, on the brain. This was done on women. And basically it's showing a neuroscientist took PET scans of brains pre, peri, post menopause, and in these bright colors, and I can send it to you. It's fascinating. And you can actually see that the postmenopausal brain is not lit up. Like there's dark areas, where in the premenopausal brain, it's very well lit and everything's connected. All of a sudden, when they lose their hormones, it's disconnected. So if you're postmenopause or perimenopause and can't remember things like you used to, or you feel this, a lot of people say, I feel like I have ADD. I can't focus anymore. I can't recall things or words as I'm telling a story. That's low hormones. So it's protective of the brain. The conclusion of that study is that it prevents dementia and Alzheimer's. So I'm all in for that reason too. So your brain, pretty much from your head to your toes, you're going to see better health and certainly better quality of life. Because if you're not having the symptoms, the joint pain and the fatigue and the hot flashes and the low sex drive, and certainly for women postmenopausally, if you've been without a cycle for any number of years, probably already have vaginal atrophy and dryness, which is not fun. I certainly did postmenopause. And so I was avoiding sex like the plague, which is not how you want to live. I mean, you want a good quality of life. If you're in a relationship, that's a big part of it. So it also, as I mentioned, protects you against many age-related conditions like osteopenia, dementia, Alzheimer's. So really good reasons to do BHRT. So what are your options with it? So there's a lot of different delivery methods for the hormones. Originally, I started on creams. Went to a compounding pharmacy and started rubbing on, I think it was progesterone and estrogen that was compounded for me. That's one way to get it. The issue is that it's not a very consistent delivery method. Same thing with oral pills. So if you take a pill or you rub a cream on, your levels are going to go up after doing that. But over the course of the next several hours, your levels start dropping because your body's going to flush it out. The creams also are messy, and you have to rub them on twice a day, and they transfer. So if you have pets or grandkids or children, you have to be careful where you put it and not to transfer it. So it just wasn't a great delivery method. You're kind of on a roller coaster, an up and down thing. We prefer pellets here, really because they're more effective, more consistent in the delivery method. So they work automatically with your body. They give you hormones 24/7. So every day I'm getting consistent, every day and every night, consistent levels of hormones. They're safe, they're safer. We can do very low dosing with pellets. They're tiny, they look like little tiny Tic Tacs. And they're inserted under your skin back here in the upper gluteus maximus, the kind of the hip area above your tushy. It's not painful. They numb it with lidocaine and they make a tiny poke. It's about the size of a grain of rice. They put the pellets, and you would get a testosterone and an estradiol pellet in that fat layer, and then they put tape on it, and you are good to go. You can go right back to work. There's no downtime. I do my pellets early in the morning usually, and I work all day, no problem. But what's wonderful about them is then your levels are going to start rising, and they stay steady, nice and steady, because it's emitting all the time. The other thing I love about this is that we learn your body through the lab work that we do, and I'll go into that in more detail, but we all get different dosing. It's very individual. We all pull differently from these hormones. So I don't have any symptoms, zero of menopause. And I'm post-menopause now, my gosh, 15 years. So It's pretty amazing that I'm 60 and I, have not a single symptom. So, and certainly I have much better quality of life, and I have a very active relationship, which is awesome. So they're safer, so we can do lower doses because they're not being swallowed like a pill where it's getting, you have to dose higher because a lot of it doesn't get used because it's going through your gastrointestinal tract. It has to be processed through the liver. And the creams, you rub a cream on and you go out into a summer in Richmond and it's 100 degrees, you start sweating. So half of that cream gets on your clothes or your sheets at night. And so you have to do a higher dose in order, for that to be effective. But with the pellets, you don't. You can do very low dosing. It's hassle-free and convenient, obviously. So what can you expect? A lot. You can expect certainly an increase in sex drive for men and women, a biggie. Improved muscle tone, improved skin elasticity and moisture, which is big. We start really getting dry skin without those hormones. Increased in bone density, and I mean an increase. So people will say to me, well, I already have osteoporosis, right? I'll say, well, we'll see, because when you go get your bone scan, if after you've been on the hormones for a while, it's going to improve your bone density. Reduce risk of heart disease, and there's a big study on that I'm happy to send you. So people used to think it was dangerous for the heart. I have a lot of women that come in with heart conditions and men, and they'll say, well, I've had a stent or I've had this happen. Can I still do the hormones? I'm like, yeah, absolutely. This is only going to make your heart stronger because your heart's a muscle. No more hot flashes or night sweats, a lot more energy. And it's not just more energy, it's motivation. So that's, I remember without my hormones, just going to work, coming home, couldn't wait to get in my pajamas and just veg. I just had no motivation, not to work out, not to do things. I just, and I hear it a lot when I talk to women and men that come in, they'll just say, yeah, I used to go, and now I just want to stop. So more energy and motivation. Better mental clarity and focus, absolutely. Better sleep, yes. Better mood. So it's great for anxiety. It's great for irritability and mood swings, depression. I see a lot of women, mostly women, who are put on prescription drugs during perimenopause and postmenopause, because when they tell their doctors, their regular doctors, and they say, I'm not sleeping, I'm really irritable, I'm just have no energy, I just don't feel like, I don't even feel like getting out of bed. Well, then they get antidepressants, they get anti-anxiety meds, they get sleeping pills. So by the time they get to me, I'm looking at the list of meds, and I'll say, when did all this start? Well, a couple of years ago when I started, my cycles got wonky, or when I went through menopause. It's not that you don't need to be on all those drugs. You just need to get to the source of the problem and fix it, which is low hormone levels. So mood, I got a little way late, but that's related to the mood issue. Vaginal moisture and rejuvenation. So it reverses vaginal atrophy, which is awesome. So, if you have good hormone levels, you won't even need outside lubrication, which is great. And for men, improved erectile function. Okay, so how do we do this? We start with lab work. So initially you'd come in and either meet with Linda or myself. You'd get your labs drawn at that appointment. That's a big lab. It's a CBC. So that's a complete a blood lab, like complete blood profile. And then we also will do all your hormone levels. We do check your thyroid also. For men, we check their prostate levels, and then B12, because we use that here in injection form as well. Then you'll come back usually about 2 weeks. We give ourselves a little window. We want to make sure your labs all get back in, and we want to get you on the schedule with a practitioner. Here we have an MD who's an OBGYN. We also have a nurse practitioner, 2 PAs, physician assistants, 2 registered nurses, 2 MAs. So we have a big medical staff here. So, but you would meet with a practitioner for your physical and approval. And the physical is not like where you get naked. It's not as big as your yearly physical with your doctor. It's really just listening to your heart and lungs, going over your health history, your medications, just making sure you're a good candidate for the program. So at that appointment, you would get your first insert. And then you're pre-scheduled at that appointment to come back in 6 weeks. The reason being, we want as your hormone levels rise, 6 weeks out, you're really kind of at your peak. We want to see, where did this bring you? As I mentioned, everyone's body is different. So we could weigh the same, get the same dose. One person may get into great range, the other may be halfway. So we have to make adjustments, especially initially. So 6 weeks, we do a lab. Pre-schedule you for a return visit at the 8-week mark out, because if you need a booster, let's say you're not quite there, that would happen at the 8-week mark. If you don't need it, then don't worry about it. We would call you and tell you don't need to come in. You look great. Then these time release for 3 months. So 12 weeks out, we're going to need to reinsert you. So you'd come in at 10 weeks for a lab ahead of time. And then at the 12 weeks, we would do your next insert. So from that time moving forward, every 3 months, we do a lab first, and then we follow that with an insert. So typically we'll see you quarterly. You can use LabCorp if you live far away. A lot of people say, well, I don't know if I can drive, so I have to drive there and I have to drive back again in 2 weeks. But if you're, down in South Hill, or we have people who come to us from the beach in Roanoke and all over the place, you can use any LabCorp. We would send you the requisition form to your email. You could print that, take it to your local LabCorp. They'll bill us and send us your results. You don't have to pay them or mess with that. And then you're already pre-scheduled to come in for your insert. But if you're in here in Richmond and convenient to come here, then you can just come in here for labs. We certainly have a full lab here. Let's see. What hormones will I receive? Well, for women, it's going to just really depend on you. So that's why we draw that initial lab. So if you're post-menopause, you'll need all 3 of those. And testosterone and estradiol are in pellet form, but progesterone is not. It is a sublingual, a little troche, we call them, and they go under the tongue at bedtime and dissolve. The reason we don't use pellets for progesterone is it's primarily for sleep. So we want you to get the majority of that overnight. It's also great for your mood. So we like to refer to it as the happy hormone. And you need it to balance your estrogen. So we're really mimicking what you made when you were young, because that's what we know when you're going to be safest and feel the best. So that I do want to mention that the estrogen and testosterone pellets are included in our program. The progesterone is something we would fax that script to a compounding pharmacy for you. And you can pick from a list that we have. They will ship it directly to you because we're not a pharmacy. So that's an outside charge. That's usually going to run around $33 a month for that progesterone. Okay. Men, what do they get? They get testosterone, and it's also based on what your labs say. For men, I don't know if we have any on here tonight, but I will tell you, a lot of them say, well, my doctor says I'm normal, but I'm having all these symptoms. Well, most of the time, if you get your labs drawn by your regular doctor, he's looking at the LabCorp values, which drop as you age, right? So when you were 20, you probably had 1,000 in your blood serum. When you're in your 50s and 60s, you may be down to 300-400. It's still normal range for LabCorp, but it's not normal here. So we want you to have the levels that you had when you were younger, because that's when you're the healthiest and when your body is functioning at its peak. So that is why we dose up here to levels you would have had in your 20s. So men here get pellets also, testosterone pellets, and we do check your progesterone in your labs. And if you're not sleeping well and your progesterone's low, we give you a very low dose of that. It's done in the same manner. We call it into or fax it into a compounding pharmacy for you. So that is the program here. I'm going to stop sharing and come back in here. Okay. Let me field any questions that you guys have here. Let's see, before starting BHRT, will I be tested to see my exact hormone levels? Yes, that's the labs that we draw. So we do a full hormone panel. We do your estrogen, your testosterone, your progesterone, your follicle stimulating hormone, your FSH level. So that's how we know what dose to give you. And we do start conservatively, knowing that we can add. We want to, we want to see how your body's doing with this. Let me see if I have any more questions. I do not. Okay, I'm going to give you guys a minute in case you're typing. Usually I get quite a few questions. We'll see. Either I did a really good job and I answered all your questions already. You guys are asleep, or I don't know. Maybe I was boring. Okay. Well, so thanks. Oh, wait, maybe hold on a minute. Okay. Yeah, I was just checking them at you now. Oh, I just have the one question. Oh, wait, now they're showing up over here on the Q&As. Okay. Is this covered under insurance? It depends. So if you have Aetna, AETNA, they are typically pretty good about covering at least, I think our clients usually tell me somewhere between 50 and 70% back, depending on their plan with Aetna. Anthem's not very good. I'm gonna be honest. Very rarely covers. It has to be like some kind of an out of state. It's not good in Virginia for this. The other plans are individual, like Blue Cross and Blue Shield. Some of them, like the out of state ones, will cover it. So as long as there's not Anthem on your card, we would give you all the forms to try to submit. You would submit it, you would pay us, and then you would get reimbursed from your insurance company. But we give you the forms with all the coding and everything ready. So it's a pretty simple process for you to turn it in, and then they would send checks directly to you. It's going to show that on the forms, pay to patient, because you've already paid us. So what about thyroid? So thyroid, we don't really treat it. We check it, and if you have a thyroid issue and it's not treated, we would definitely, recommend, you say, hey, this is hypo or hyper. You need to see your PCP about this. If you're already on medication, it's fine. I mean, we're just checking it all the time. We want to make sure that it's at good levels, it's operating well, but we don't do thyroid treatment as a mainstream thing. We do some prescriptions for some of our clients that their own doctors are kind of, what would be the word, old-fashioned, and will not treat thyroid like it needs to be treated, meaning we like the thyroid, the TSH, to be at 2 or under. And many doctors who don't read the new science will let that number creep up to like 4, 4.5. And by then your body is really sluggish and you're exhausted and you're gaining weight, you're losing hair. So when we see that, we ask you to talk to your physician, but if they're not going to treat you, we'll definitely get you some natural thyroid medication here. We use Armor Thyroid and Nature Thyroid. Okay. Let's see, does insurance cover? Yeah, I think I've addressed that. Depends on your insurance. We do have payment plans here though, and we do take FSAs and HSAs. So if you have flex spending or health savings, those work here with our hormones, and we do supply the documentation for that. Do you allow payment arrangements? Yes, we do. We have monthly, we have quarterly, so definitely can discuss all of that with you. And you do get a discount for attending my Zoom. So you get $200 off for the year. I always, so after, we finish tonight, what I do is I go and I check the attendee report and then put you in the system so that if you contact me, if you want to move forward, you can always reach out to the email where I sent you the link. And we'll get you on the schedule. And then when you come in, it'll show that you attended. So you will get the discount. Okay, let's see here. All right, I think that's all answered. Let me make sure I answered those. Yes, I think I have. Wonderful. Well, if you guys are wanting more information, or if you are ready to move forward, or if you just have some questions, whatever, please reach out. And I will tell you, I'm just going to tell everybody this, what I tell whoever's sitting in front of me, and that is you have one life. And if we've learned anything this past year, with COVID, and even I was laid off for a couple of months, being housebound and just dealing with life and stress. Quality of life I think, is so much more important to all of us now, realizing, wow, it's precious, and feeling good, and having, being able to be with our families and enjoy a good, healthy quality of life is more important than really anything else. So I would really encourage you to do this, to just give it a try. I mean, our contracts are very wide open, meaning you can start this and stop this at any time. So we prorate it. So if you do a half a year, you only pay us for a half a year. But I'll tell you, it's life-changing. And if I don't pay full price anymore because I work here, but if I didn't work here, I'd be paying full price. And I'm, if I move or something happens, I'll continue on this forever. The discount is valid forever. So yeah, there's no, like, you have to come in tomorrow. You can come in when you can come in. And will I get a discount if I'm already scheduled? Yes, you will. I'll put it in there that you attended. So you'll definitely get that. Okay. All right. Well, thank you so much for sharing part of your evening with me, and I hope you reach out. And if any of you are interested in any more of the documentation, any of the studies, just shoot me an email and I'll send it right back to you. Okay. All right. Have a great evening, and I hope to meet you soon or see you soon if I've met some of you. Sometimes I've met some of you, but anyway, thanks again, and have a great evening, everybody.